that to start. We were just talking to Dr. Jon Stone from Scotland, and we were discussing some of the work that was being done in FND. And maybe Dr. Stone, you can kind of just enlighten us on work that you're doing. And
well, work that I'm doing. I mean, our research group is interested in lots of strands. Really, I've got a PhD student, Ingrid Huritzauer, who's doing a 3-year PhD on patients who present to neurosurgical units where there's a concern that they've got some kind of pressure on the nerves at the base of the spine. So patients commonly come in with weak legs and bladder problems. And we've discovered that half of those patients have normal imaging and are usually just sent home without any diagnosis. And so we're investigating them to see how many of them have FND, and we think quite a number do, and we're interested in the way that FND might cause bladder problems. We think that's a big area. We're interested in physiotherapy as a treatment, and other treatments as well. We're involved in a large multi-centre trial called the CODES trial in the UK, which is investigating the role of CBT, cognitive behavioural therapy, in dissociative seizures. And that's managed to recruit over 300 patients. So that's a real step change in the size of study in this area.
that's great to see such a large research project going on and to see the work moving forward. As we were talking before some of the other people joined, I think as people are just coming into the FND world and new to the diagnosis, it can feel like that there hasn't been a lot of progress. And
Yep.
That's not the case. It actually is moving, and the work that you're doing is fabulous along with many others. And so I think it's just great to hear that.
I know. I think for people out there, if you've not seeing a doctor who's interested and you've not been referred to anyone, it won't maybe help very much. But I think there has been a massive change, a massive increase in interest over the last 5 or 10 years. And a conference we had in Edinburgh in September, 550 people came from around the world to hear about FND research, and it was really encouraging how many new clinics there were and young doctors and other health professionals interested in this area. So the future's looking much brighter than the past, I would say.
Definitely. And I think just like on this webinar, we've got people saying hello from Melbourne, Australia, and all over the world. And I think it's really great that people can start to come together and discuss these issues. And one of the questions that's been asked is a new one I haven't had before. Jacqueline is asking if she had been diagnosed with FND and then had a spinal during her pregnancy and during childbirth, and both her legs have been a lot better since. Do you know why this may be?
Wow. So, better since the spinal. So that improved her symptoms. Yeah.
Seems to. I have never heard a question like that, so I don't know what.
Well, it's interesting. So, I mean, I meet a lot of patients whose FND begins around childbirth, or often around. And in fact, I met a patient today whose FND began after a lumbar puncture as a treatment for another condition. And I think we know that physical injuries and surgery can trigger FND for a whole variety of reasons. I have also met patients whose FND has improved with a physical injury, or or a procedure that really shouldn't have improved it. Had a patient who hit their head and their FND got better. I'm not recommending anybody goes and hits their head, but I think it's very interesting. It does happen, and I think sometimes when people have, I don't know if this lady's spinal was painful or difficult or complicated, but I think that process can sometimes interfere with the brain and nervous system in a way that is similar to how it interfered with it in the first place, but somehow the pieces fall back in the right place again afterwards. So yes, I have heard of that, but please don't go having injuries and trauma.
Most definitely. Another question from Paula she asks, is it possible for side effects from medication to present as FND? And I would kind of just ask, we had a couple people that had, and I don't know if they're misdiagnosed or if their symptoms were a result from medication. So
Yep.
we see medication kind of playing a part in all of this.
Yeah, well, so medication, you know, for all of it, it can be useful, does undoubtedly can cause side effects, and particularly strong painkillers, I would say, opiates. We discussed those last time. FND should only be diagnosed when there's positive evidence of the disorder. So when you've got, you know, a positive Hoover sign in a weak leg or a positive entrainment test, etc., for a tremor. So it's not a diagnosis you should make just because someone's got a neurological symptom, they're feeling unwell. That's not good medicine. It's not good neurology. I've certainly do meet patients where a medication gives them side effects, perhaps makes them feel unwell, and then that triggers FND. So there's a sort of, there can be an indirect relationship. I wouldn't say, and some medications do make you feel very spaced out, and medical word for that is dissociated. So, and some aspects of FND are about feeling dissociated or disconnected from a body part which doesn't feel like it belongs to you. So you can see how it might make it worse. So the answer is yes, they can trigger it. I wouldn't say that they would cause it as such. I think they can be a factor in its development.
That kind of puts us on our next question from Paula that asks what the percentage rate of misdiagnosis is.
Yeah, so well, that's a question that I looked at very carefully. So I looked at all the studies since the 1960s where people had looked at this question and found that in the published studies, about 4% of patients had been misdiagnosed. So that these are people who were told they had FND but turned out to have MS or epilepsy. We did another big study in Scotland in over 1,000 patients and found a much lower rate than that actually in a more recent study. And I would hope modern investigations and assessment reduce that. So that was about 0.5%. What you have to, and you might think 4%, that's really bad, but actually if you look at it the other way around, what proportion of patients are diagnosed with MS and actually have FND, it's probably a bit higher. It's probably 5 or 6%. You know, what proportion of patients are told they've got epilepsy and take treatment for 20 years and then discover they've got dissociative seizures? Probably 5 to 10%. So we should be worried about we should always try and be accurate with our diagnoses, but doctors can never be 100%. Sometimes people have both as well. So it's about 5 to 10% in both directions, or it's a bit less than 5%.
Well, I'm glad that you also mentioned that some have both, because I think that that's what we run into often, is that it's kind of this thought that it's either or. And so even when someone's had an FND diagnosis and then they get a new diagnosis, there's often like, oh, it's misdiagnosed, but you know, there's a good possibility that there was an overlay there of both. And do you feel like if we can learn to accept those functional symptoms a little bit better, then we would start to recognize them in many other illnesses as kind of overlay?
Yeah, I think we would. And I think just as we say, you know, if someone's got MS, then they might have migraine as well, and you would treat their migraine. You can have more than one thing. And actually, I am very interested in the patients I see. For example, I have a number of patients who have dual diagnosis, so they have Parkinson's and FND, or MS and FND. And I think what happens when you think about that long enough is you realize it's actually, you kind of want the problem to be FND rather than MS, because FND has that potential for reversibility through rehabilitation that these other conditions don't always have. So I think we should be looking for FND and being happy to make the diagnosis alongside neurological diseases, and not just calling it functional overlay either, and saying, you know, you have FND and Parkinson's, and let's hope that most of this is FND, for example.
Well, and another thing that you touched on about being glad to have FND, and I think that many are happy as long as they have access to treatment. I think
Well,
that that's kind of where that
sorry, I didn't mean glad. I mean, no one's going to be glad to have FND. I don't want to
right.
have FND. But if you're faced with a choice between your whole condition is MS, which can be treatable but may not be, or FND, which has the potential for treatment, absolutely yes, you have to be in a centre where people are interested and want to help treat that. I agree. That's
Right.
something for the future. Yeah.
Definitely. We have another question from Dee, and it kind of goes with what we're talking about on what are the statistics of FND, number correctly diagnosed. I know there seems to be kind of a variance in numbers that we hear once in a while. What is your thoughts on those?
Well, that's similar to the first question, isn't it? So the number correctly diagnosed in all of the studies since the 1960s was about 96%. That was when you followed people up after 5 years on average. And in a big Scottish study, it was more like 0.5%. So that means 99%. Now, it's probably not as good as that. And there will be people who turn out to, where the diagnosis is incorrect. But I think we've just done a follow-up study in Scotland over 14 years looking at patients and found very few where the diagnosis was incorrect. Only 1 or 2 out of sort of 80. So yes, it will sometimes be incorrect, but nearly always it won't be if it's been made by a neurologist, and particularly if they've made it carefully using positive evidence and they've not just made a diagnosis because the tests were normal, which is not how you make this diagnosis.
Great. And we also have a question. Matt is actually here with us from the FND Hope UK board, and he's going to help jump in and ask a few questions as well. Matt, you want to go ahead?
Yeah, so we've got a question here from Tanya that's she's asked, with FND we hear a lot about retraining the brain. How does one achieve that? Is it by gradual exposure to things you'd normally do on a day-to-day basis?
Yeah, well, that is the $64 million question. How do you retrain the brain? With difficulty, I think. The whole point about FND is that in very simple terms, what's happened is the brain's developed a pattern of working, which is wrong, which the person doesn't want. You've got weak leg or tremor or blackouts. How do you change that pattern, or from when the brain thinks that's normal, when it's not? And there are many ways to do that. The main ones being by practicing different movements, and that would be physiotherapy. But sometimes thinking about that in more depth and working out how has this happened. Are there ways that I can get into retraining my brain? If you're having seizures, for example, is it the case when you have a seizure that your brain is going into a state of red alert, and then this program is getting activated that makes you black out? Can you sort of interfere with that and make it go down a different path? So certainly it's not easy, and it needs guidance, and for some people it's too difficult to do that because they're to retrain the brain. And that's why FND can be a chronic condition. But yeah, physical and psychological rehabilitation is the short answer.
Thank you. Another question from Michelle is, she's asking in regards to her friend. She says her friend gets rigid contractions followed by shaking that wake her from her sleep. Can FND make someone have abnormal movements in their sleep?
Yes, I think is the answer. What's interesting, when those patients have been assessed in a sleep lab, quite often what you find is that abnormal movements or seizures that are apparently occurring during sleep and feel like they're occurring during sleep to the person are actually occurring in very light sleep, or actually the patient's not asleep when it's happening. It just feels like they're asleep. So that's one thing. The other thing is in FN that there are a range of abnormal movements that occur in sleep, which do occur in deep sleep. There's something called hypnic jerks. There's another thing called periodic limb movements of sleep. those aren't FND as such. They're sleep movement disorders. But I think some people with FND have an amplification of those as part of their condition. So I don't know the answer to that particular. That's sort of general answer to that question.
Thank you. We're going to take one from one of our members that have raised their hand. Well, do they not? I guess they're not there now. I can't bring them over. So we'll go ahead while they're getting transferred over to the panelist side. We'll ask another one. Marilyn asks, is pregnancy safe with FND? Are there any proven triggers besides stress or trauma? I don't know if she means those related. I'm actually thinking she probably means them separated. But
are there any? So is the question, does pregnancy make FND worse, or? Well,
is pregnancy safe with FND?
Is it safe? I guess that could mean, is it safe for the mum and the baby? Perhaps.
I would believe so.
So my experience is that it is. Yes, it is. I've never come across a mother or a baby who's been harmed by FND. There might be someone out there who's proved me wrong, but it's an understandable worry, particularly if you have seizures. Mums worry a lot about, what if I have a seizure and I fall down, am I going to hurt my baby? Or once they're born, am I going to drop the baby and hurt it? I've asked experts from around the world this question, and I've never met anybody who's told me about a story where someone came to harm. And you think, well, how could that be? And I think it's an interesting question. I think when people are having dissociative seizures, although they often can't remember it and are unresponsive, they're not actually unconscious in the same neurological sense as someone in a coma, for example. And I think there are some protective mechanisms that are retained that enable protection of a baby, etc. So, yeah, I think I have quite a lot of patients who improve during pregnancy as well. So I'm not suggesting that people should go to improve their FND, but I certainly wouldn't put anyone off pregnancy who's got FND. Basically, I can understand the challenges, but I wouldn't put anyone off.
It's funny you say that, because we have had people that said that their symptoms seem to diminish, not necessarily go away, but when they became pregnant, they weren't as bad. And
yeah,
and as you mentioned, that's not a reason to have a child by any means. But
and I've met some where it got worse too. So
absolutely,
yeah, you got to be careful.
So I do think that it's such a unique experience for each individual. And so, just a reminder to everyone that is listening, we can answer a lot of these questions, but without knowing the extent of your personal health history and anything like that, please don't do anything or change any drastic medications without discussing it with your healthcare provider.
General points I'm making.
Yeah. Another question from Monique is, why is it when I get run down, that's when I will see my symptoms more exaggerated? Is there something that she can do to prevent this?
Sorry, when she gets what, sorry?
A great question by Monique. She says that she seems to become more symptomatic when she gets run down, when she's done too much. And is there something that she can do to prevent this? Very common problem. Very
common. I mean, I suppose one of the difficult things there is that fatigue and being run down is a very core symptom for the majority of people with FND. I sometimes meet people with FND who haven't got fatigue, but I would say 90% have some form of fatigue, and many have incapacitating fatigue. So you could say fatigue is not, being run down is not part of the definition of FND, but I think it's a part of the disorder, really. If you're run down because you have the flu or for some other, or you're sleep deprived for some other reason, well, your brain doesn't work as well when you're sleep deprived, or if you have the flu, or if you're feeling low. We know that from all sorts of studies. So it's not, if you have a disorder where your brain and nervous system are already not working, and then something else comes along to knock it, well, it's going to be worse. I think one of the answers to that, one of the things to really think hard about there is if you are getting run down, is are you sort of doing a sort of boom and bust type of thing where one day you do have a bit of energy, and because you've been ill, you want to catch up with all the things you haven't done, and then you overdo it, and then you feel terrible and run down that day or the next day. That's very common. Learning to sort of balance out that those boom and bust can be a very helpful way of beginning to manage feeling run down. Easier said than done, though.
By all means, but definitely great advice. I think that when you can move out of that boom and bust period and balance things out, life eventually kind of smooths over a little bit, and you can find where your norms are and kind of reestablish those. I think Matt had another question for us. Go ahead, Matt.
Yeah, this one's from Charlie. He's living in Somerset, and he's asked a question, and a couple of other people I've seen on the chat are asking a very similar one, so I thought it made sense to bring this one out. But Charlie's just been very recently, in fact, last Friday, he said, diagnosed with FND. So he's interested to find out what support is offered in the NHS in regard to treating this disorder. And I've seen a couple of other questions that have been asked around how to get access to the level of care that you really need in order to support this condition properly.
Yeah. Well, I mean, the trouble with that question is it does depend where you live at the moment. I mean, and that's the case still for many other conditions, but we are in a situation where care is around the UK and in the world is very patchy, and you have centres and places where people are interested and where people can access. I mean, ideally, you want a multidisciplinary team. There are places where you can access that, and there are places where you can't. That is the reality of the situation. So I think Charlie needs to ask the person who made the diagnosis to, if he has a movement disorder or a motor symptom, can they access a physiotherapist, for example, who's got some expertise in this area? If they have seizures, do they know any neuropsychologists, psychologists, neuropsychiatrists who can help? Is the neurologist going to see him again? If not, why not? It's a very difficult one for me to answer. I would say that services are improving slowly, but that's no good for someone who hasn't got a service.
Yeah, no, that's very true. And I think for anybody else that is concerned about getting information, obviously referencing your own website, neurosymptoms.org, is a good place for wherever you are in the world to get information. So if you're finding that you're struggling with patchy information or lack of information to give to your GP, that's a great source. There's obviously our own website. There's lots of good materials in FND Hope as well.
Yeah.
So
I think you can make the point now that we're entering an era where we've actually got randomized treatment trials of FND which show benefit. So if a local service is not providing that treatment, I think you have to say, why not? Okay, these are relatively recent trials, but these are treatments that can be very effective. They are, when they work, they are remarkably effective, more so than arguably many drugs we use for other neurological conditions. So we do need, I think the patient community, it's fantastic that there is now a patient community, and I really hope that pressure from patients will be very important actually in changing services. My experience is that health services listen much more to patients than they do to people like me moaning about the fact I haven't got a specialist nurse or specialist therapist, which I don't. But I expect if 100 patients wrote letters to my chief executive, I probably would have one.
Definitely. Well, I'm going to go ahead right now and plug, with that is that we do have a petition to the government, and we also have letters to the MPs that are on the website where we've done most of the work already. We just need you as our members to go in and sign the petition and really try to help move the agenda forward and get the attention of some of these government officials. We also submitted comments to NICE guidelines recently, and there's work being done in all the different countries, and we just need the participation of the members to kind of help move that agenda forward.
And I think there is a receptiveness out there as well. In you explain this condition to people, it's so common actually, or in its various forms, including milder forms, that actually people do recognise what you're talking about, and they can see that there's a need, and you explain the frustration of it. Normally, someone knows someone who's had that experience, and perhaps not in FND, but in other functional disorders as well.
I find a lot of that same conversation when I meet people and tell them what I do and different things. It seems like there's always someone that says, "Oh, I have an aunt," or "I have a cousin,"
Yeah.
that has things like that and symptoms, and so I do think that it is a lot more common. We just have to get out and talk about it and be open and try to push the agenda, forward more. We have another question here from Shirley, and this one's kind of a little bit complicated. She has started a few months ago having a difficult time with like she's not hungry, and she'll eat an egg and a banana, and that's pretty much it for the day. And she's lost a lot of weight to the point that she's anorexic. Her weakness has increased. She can only walk about 2 or 3 minutes and getting tired. Her question is regarding gastric signs. Would that be functional? Her body not sending those signals that she's hungry? And
could be. I mean, we are in a different zone there. So FND is really related to what we call the voluntary nervous system. So that's when your arms and legs and muscles that you can move, or you should normally be able to move when you want to. Whereas problems with the gut and stomach really come under the expertise of a gastroenterologist, or functional bowel disorders. I mean, there's many reasons why someone would stop eating, and and that can overlap with other. So bowel, stomach functional disorders can overlap with FND, but I couldn't say in this lady's case whether that's happened, and there may be other complex reasons for that.
Definitely, a thorough investigation would definitely be warranted.
Yeah, that needs an individual formulation, I think.
Definitely. Okay. We have another question from Stuart. He states that he gets a lot of muscle twitches, not always in the same place. Is this linked to FND?
That's a nice question. So people get different sorts of twitches. So you can have the little twitches that you feel in a muscle, which might make your finger move, or you might notice it in your arm or something, but it's not much for someone else to see, apart from if you're actually looking at the muscle. And then there's the twitches where someone gets a sudden jerk of a whole limb, and neurologists would call those jerks or myoclonus. So I don't know I think if he uses the word twitch, he probably means the small
That's
twitch.
what I'm thinking, just the kind of little small where your muscle just kind of keeps.
Yeah. So that's an interesting one. So I think the answer is yes, they do commonly, can be a feature of FND, but they don't have the quality of, for example, the tremor or the jerk, in that you can demonstrate that they change during the examination. But we know that, I mean, in fact, if you go to the population, if you asked 100 people out on the street, do you ever have twitches? It's actually very common to have twitches. It's kind of normal to have the odd twitch. What's interesting is that if you notice a twitch, and I've done this myself, if you notice a little twitch in your eye or your hand, and you keep noticing it, it does actually make it a bit worse. So there's some sort of process of amplification going on there. And I have patients who are literally twitching all over, and I can see it. And there's a condition called benign fasciculations when that happens. And those patients don't have a neurological disease, usually. There are other things that can cause that, but most of them, it's benign. And it's something we see quite commonly in medical students, actually. And actually, I've seen it in trainee neurologists who get these twitches, and they start to wonder if they're getting ALS or motor neuron disease, because it can be a sign of that. But they haven't got that, but the twitches have amplified. So we're still learning about how these things work, but there's no doubt that the brain can do some pretty strange things to you. And benign fasciculations and twitches is a good example of that, I think.
Well, I think it's also important not to discount simple explanations as well. I mean, I would certainly think that, you know, lack of water can sometimes cause your muscles to twitch, and magnesium, or, you know, some simple things like that can.
Yeah, I don't know if there's much evidence for that though, Bridget. I mean, yeah, lack of water is not good for anything, but I think twitching is also just very common in the population. I think when it would be nice in some ways to be taught more about what's normal, so you know what's normal and what's not. So, for example, having a little bit of a twitch around here, around your eye, is so common that if you have it from time to time, that's just normal. But if you don't know that, how are you supposed to know that it's normal? You know, so.
True. It's really important to mention that we not try to medicalize or make everything that happens within our bodies a symptom. That kind of a natural phenomenon that sometimes takes place. Sue also asks, FND is known to be based on the central nervous system. Is there any link to our immune system or any other markers for inflammation? Has there been research on any of those things to see if there is a link to them?
There hasn't. I'll just make sure I get the answer. I think there's a little bit of research just emerging at the moment, but I'm sure that we will find there is a link to inflammation, because we're finding that with all brain disorders. Although, you know, if you look at a condition like Parkinson's disease, which is not primarily a condition of inflammation, if you look in the brain, there is some inflammation. If you look at people with severe depression, they have quite marked inflammatory changes in their brain. Studies of patients with chronic fatigue syndrome, ME, also demonstrate changes in the immune system. So it would be surprising to me if people with FND did not have some changes in the immune system. The challenge is, how can we use that to help treat the symptoms? Does it actually direct to the answer? Perhaps it does. So it's definitely a line that we need to explore. But I think I think it's unlikely that we were going to get a sort of a magic bullet coming from research in inflammation. Or, for example, I think there would also be changes in the neuroendocrine system. So the hormones and chemicals in your brain are likely to be different and disturbed. Are we going to get a magic bullet from that research? I doubt it, but doesn't mean we shouldn't. We need to sort of piece this all together.
I think it is important to remember that there might be a lot of things that contribute to the illness. And as you mentioned, it's not necessarily going to be a magic bullet for one thing or another. There again, I think research is vital to finding those answers, and we encourage people to sign up for the scientific registry to participate in that research. Sometimes just gathering more data could be the answer that we're looking for. Someone also mentions a piece of research that was recently published by David Perez. I don't know if you saw that. He was at the conference.
Yes, I know.
And so I think, I'm not sure if there's a question, but I think just highlighting some of the new interesting things that they are finding with research, that's also, you know, highlighting some previous things that have been done. So I think it's great to just see a variety of people getting interested in.
Yeah, and some of David's research is really looking in more detail what is going wrong in the brain of people with FND, and how does that correlate with the very different routes that people find themselves developing FND with. So, you know, some people have had stressful events. What about the people that haven't? Do they have the same changes in the brain? Yeah, I think we're learning a lot about that.
Most definitely. Now we've got some people we're trying. I'm not sure Zoom's working. That's what the platform is entirely. Naomi, are you unmuted that you can ask your question?
Oh, hi. Yes. I was wondering if there's any connection between FND and fibromyalgia, because I've been diagnosed with both, and they both seem to have similar symptoms.
Yeah. Well, yes is the answer. So many of my patients with FND also have chronic widespread pain, muscles and joints with unrefreshing sleep and fatigue. So there's a big overlap. Fibromyalgia is another functional disorder, I would say, another functional disorder of the nervous system, presenting primarily with pain and fatigue. And in that condition, the volume knobs are sort of turned up in the pain pathways. The brain is responding in a way that means the person experiences pain and fatigue. So they do share a very common mechanism, I think, and we should be talking about them together. But doctors don't make this easy by coming up with all these different names for things. And but I think fibromyalgia is a helpful concept, and because it can lead you to that area and see that just how common that condition is.
Great.
Hi there.
We have another question by Marilyn. If you want to go ahead. Hi, Marilyn.
Hi, how are you? I'm from Australia. I hope you can understand me. But I was just wondering about like triggers and stuff like that. I know that stress is a big trigger for me, but then there's also, I've heard and read that there's lots of other triggers out there, but I'm finding it hard to diagnose. Is it dietary, or is there anything that's actually proven?
So it depends. Are you talking about, do you have episodes or attacks of symptoms? Is that what you're talking about in terms of triggers?
Yeah, like, so back in March, just in a nutshell overview, back in March, I sat in a chair and I went paralyzed. And then in July, I had a TIA stroke, which set off a lot of symptoms. For a period of time, I could only move one finger and communicated from writing words in people's hands. And that's all I could do.
So you've had episodes of really severe acute symptoms. It's a really good question, because I think it's entirely natural when that happens that people say, well, okay, if only I could work out what the triggers are, then it won't happen again. And you don't want it to happen again, basically. How can you stop it from happening again, or when you're trying to get better in between? And the problem with that is that this FND is often really unpredictable. It's often really random, and there isn't necessarily a reason why it happened at that moment. For some people, yes, they notice that they've been very stressed, and then they have an FND problem. That definitely happens. I have probably more patients who develop acute episodes of FND in situations where they're really doing very little. They're just sitting quietly, perhaps feeling a bit run down, and it's almost as if they're more likely to dissociate when they're not doing anything compared to being busy or stressed. And for other people, that you cannot find a particular reason for it. So I think if you were, I would advise not looking too hard for those triggers, because it could be a very frustrating exercise. But focusing a bit more on what am I going to do when I start to develop these symptoms, when I start to get the paralysis. Some people, it just happens all at once, but for some people, it sort of builds up. They feel very disappointed, they feel frightened. Can you do something about those feelings of disappointment and fear at the moment it begins? I would say not easy, but I think that patients tell me that looking at those things has helped reduce the severity of their relapses. If they kind of half expect they might happen, and then think, well, what am I going to do when it happens?
So can you suggest anything that might possibly work for, so like a generalized thing that you've heard of that works?
Well, I'm not sure what you mean. I mean, I don't want to make suggestions on your case, but I think you're talking about relapse management. So anticipating relapses, working through what are your thoughts when you have a relapse? What do you have confidence about the diagnosis? At that moment, are you thinking, I'm paralyzed and I might never recover? Oh, hang on, you still got me. Yeah. And then if you have been fortunate enough to meet a physio, for example, or a psychologist who's interested, have they been able to teach you some techniques that you can use at that moment when you're having a relapse? I think there's quite a lot of mileage in that. And yes, it's good to look for triggers, but you can't avoid stress. You wouldn't want to avoid it. You know, no one wants to have a life of no stress. That wouldn't be a life, really. So I think it's easier. I think I see a lot of people looking a bit too hard for triggers when it's a bit more of an unpredictable condition, I think.
We have had, you know, since you mentioned some of the tips and things, there are some on the website, and it depends. I think each individual have different things that work for them, and it's important to find those things. I know a couple people found that walking and doing something to distract their mind a little bit, whether it's changing their balance back and forth and then taking a step, or, you know, carrying a rock or something in their pocket that they can just rub on, that will kind of help keep that from disassociation and things like that. So there are a lot of little tips and tricks that people have found that seem to help.
If you look at there's a page called treatment on the treatment page of my site. If you look at treatment of attacks, there's a couple of pages there with some ideas, mainly for people with blackouts, but I think that can work for people with relapsing paralysis and relapsing movement disorders as well.
We have a couple questions and she was from Australia. We've got a couple people in America asking, you know, the differences between the countries. So our bishop mentions about US being behind some of the other countries in their thinking. And what are your thoughts on that? Have you noticed a variation when you speak to doctors from different countries?
Yeah, I mean, there are wide different, there are, it's come back to this issue of service and interest, and there are lots of places where I think there's probably nobody interested in this, unfortunately. And that does vary to some extent with countries, but even in the UK, where I think we're doing quite well, I'm sure there'll be lots of people listening who live in parts of the UK where there is no one interested particularly. But I think I'll repeat. I think it's changing slowly. There are some parts of the world where I really don't know what's happening. So, for example, I don't have many communication with neurologists in China. I only know one or two in Russia, for example. So, you know, who knows what's happening in some of these places. But I see research coming from all over the world, and I was very encouraged at our meeting. We had delegates and abstracts from 5 continents. So that was really something. I was really delighted about that.
It was great to see some of the other countries that we don't see represented as often. You know, interesting as far as our data statistics on our website, Iran and Iraq, that area actually has a lot of people that come to the website. And we've even had a few doctors contact us during research and stuff. So it really is a global problem and concern.
One thing's for sure, whenever I meet a neurologist from another country, they always have FND, and I say, do you see much of this in your clinic? I shared a stage with someone from Morocco, and he said, yes, it's one of the commonest things we see, you know. And so it's all over the world. I don't think there's any doubt about that. It's not just a product of one particular culture, or even it's not a product of our time. It's been there all the time, just kind of ignored, I think.
Great. We're running out of time, and so one last question that I think is really important that we do address that is anonymous person has asked is, can FND ever be fatal or life-threatening to patients?
Well, that's okay. Can it ever? I would say virtually impossible on the basis of just the symptoms alone. So what people are often worried about is that they're going to be paralyzed and they can't breathe and they might die, you know, or they might have an attack but they don't wake up, or their throat's going to close over and they're going to die. Those things do not happen. I think what we do see from published studies is there is a mortality rate, particularly from suicide. And I would regard that as a consequence of, in some cases that is a consequence of FND, or people taking themselves off to Dignitas in Switzerland. I've heard about that as well. I think there are some people who, there are cases on record of people who are so immobile with their FND that they die from medical causes of sort of consequences of immobility, in the same way that someone with a stroke might as well. So it's rare, and it's certainly not a direct cause of the condition itself.
And one final question before we go. I think a lot of members, and you mentioned suicide, is the question is that they've been newly diagnosed and they're feeling very low, and depression is kind of creeping in. And do you have any suggestions on how someone can stop that depression and trying to find, I guess, hope?
Yeah. Well, yeah, I think you can find hope. I would try and find hope from thinking about the nature of the diagnosis. So what we're saying in FND is there is a disorder of the nervous system. It's not functioning correctly. But the tests that we do to make the diagnosis actually typically will demonstrate that there is some potential for reversibility. And it's hard to achieve that, but it is possible. So to bearing that in mind, it's not a sort of disorder where it's all just a big mystery and we don't really know what's going on. We understand quite a lot about it. And the other thing that we often shy away from is it's nice to have a question about depression, because depression and anxiety are very common in FND, particularly anxiety actually. They are much more common in FND than they are, for example, in patients with MS with equivalent disability. And lots of people with FND don't have anxiety and depression, or they become very sensitive to talking about it because they feel that doctors are sort of angling and they're going to blame it all on anxiety and depression. And I don't blame them for being sensitive. But it's great if you can get past that and say, okay, you've got FND, but how are you feeling? And do you have low mood? And we know a lot about the treatment of depression in terms of, and the treatment of depression in people with other medical conditions as well. So I think talking about the depression with hope finding a health professional where you can talk about how you're feeling and not feel that they're going to get at you or blame it all on that or blame it all on depression is a great step forward, I think, in the overall management of the condition, if you can achieve it.
Well, thank you. You've done a fabulous job. One of our attendees has said, thank you for the webinar. I don't feel as alone as before. And hopefully that's why we do some of these things, hopefully by knowing that people are not alone, that we recognize that this is a very serious condition. People are trying to help all over the world. We're working as fast as we can, as hard as we can to find those answers. And we appreciate the time that you give us on a volunteer basis. And we're hoping to bring in some more doctors in the next coming year that are going to help carry the weight of answering all these questions.
Well, I'm thinking you want to see some new faces here and get some new ideas. But no, it's been lovely to do these, and I want to thank the FND community for what you're all doing, because this, I think, is already making a tremendous difference, and in the future, if health professionals were doing this on their own, it's not going to work. It's only going to work when we're all working together, and so it's been a tremendous development to have things like this, an opportunity for anyone to drop in and hear about it. It's fantastic.
Well, great, thank you, and we will look forward to hearing from you in the future. And thank you for everyone that joined us today, and have a great week. Thank you.
Okay, bye everybody. Thank you.